I'm KieranIngram, and I'm a candidate in the Masters of Teaching program at Point Loma Nazarene University. My proposed study is on the effect of mindfulness on student behavior and completion of specialized academic instruction tasks. The area of focus for this study is the use of mindfulness exercises, namely breathing paired with visualization, in an elementary special education setting to examine its effect on student engagement and learning. The significance of this study is that this undertaking will add to the research into the effects of student mindfulness, training, and practice within K-12 education, and specifically within special education settings and populations. The findings will be useful to K-12 general and special educators and administrators seeking to improve engagement and learning for students who are challenged in self-regulation and focusing their attention. The specific research questions which will guide this study are: what is the effect of mindfulness exercises on the behavior of students in small group specialized academic instruction lessons? And what is the effect of mindfulness exercises on the completion of SAI tasks? With regard to the background of mindfulness and the research done to date, mindfulness practices are rooted in Eastern traditions, specifically Buddhism, and have developed as a secular and clinical therapeutic practice in the West over the past 50 years. Mindfulness can be defined as, quote, a state of psychological freedom that occurs when attention remains quiet and limber without attachment to any particular point of view. Mindfulness has been studied for its evidence-based effectiveness, and numerous studies have shown that mindfulness practices improve brain and immune function and overall well-being and lessen stress and depression for patients or individuals with a variety of medical conditions. It has also been shown to improve attention and to serve as a moderating force between implicit motivation and behavior. Mindfulness research has recently turned from adults to adolescents and children, from preschool to college age. In this context, mindfulness has been shown to improve executive function, attention, and well-being, as well as to lessen stress and depressive symptoms. While the research has begun for mindfulness training in children and adolescents, reviews of current literature concur that although the interventions are well tolerated and promising, research must now become more rigorous and more focused on specific populations. Mindfulness can also be seen in the context of social emotional learning, programs for which have proliferated over the last decades. SEL particularly benefits students with special needs who often show deficits in self-regulation and social and emotional development. And mindfulness training is a complement and a corollary to SEL. Thus, mindfulness in special education has been promising in showing results for children and adolescents with ADHD, OCD, autism, and learning disabilities. And now research specific to this population is now needed. This action research study will examine the effect of a mindfulness training and practice intervention within a small group special education setting. The subjects will be drawn from the education specialist caseload of K-5 students with mild to moderate disabilities who attend a public elementary school in Southern California. Disability categories within this population include learning disabilities, ADHD, communication disorders, autism spectrum disorder. With regard to data collection, data on student off-task behavior with in terms of their engagement and completion of specialized academic instruction tasks, their learning, will be collected during 15-minute intervals three times per week over the course of an 8-week period. The 8 weeks total will be broken into a 2-week baseline phase, during which no mindfulness training or practice will occur, a 4-week treatment, and a 2-week follow-up phase. The data collected will consist of 1, frequency of off-task behaviors requiring verbal redirection or prompts during a 15-minute specialized academic instruction interval, and the degree of accurate completion of an SAI task designed to be completed within that time frame. The task will vary throughout the study and will be consistently aligned to each student's IEP areas of need and academic goals. The study's intervention will introduce the concept of mindfulness and train students to utilize 2-minute mindfulness exercise focusing on anchor breathing and popcorn thoughts. The mindfulness training will be provided in a 20-minute lesson at the start of each of the 4 weeks in the treatment phase. Students will then use the mindfulness exercise immediately prior to instruction on 3 occasions per week in each of the 4 weeks of the treatment phase. The mindfulness training and exercises will be adapted from the Mindful Education Workbook and other sources available to educators. The follow-up phase will consist of students being prompted to use the 2-minute mindfulness exercise at the outset of each instructional lesson, but students will not receive formal training on mindfulness during follow-up. But follow-up will include continued data collection on the frequency of student off-task behavior and the degree of accurate task completion. With regard to the analysis of data, the frequency of off-task behavior requiring redirection or prompts will be compared across baseline, treatment, and follow-up phases to examine the effect of the intervention in the group as a whole, as well as in individual students by student age and by disability category. The degree of accurate task completion, which will be quantified by the percentage of correct or appropriate responses given within the 15-minute interval, will also be compared across baseline, treatment, and follow-up phases to examine the effect of the intervention in the group as a whole, the individuals by student age and by disability category. The study's ethical considerations will be considered and taken into account for the study by obtaining informed parental consent and student assent prior to the start of the study. School site approval will be sought and documented. Record of student behaviors and academic performance will be kept confidentially with no association with student names, and care will be taken that students are not physically, emotionally, or mentally harmed in the course of the study, including ceasing of mindfulness training or exercises if deemed warranted by students' experience of the intervention. Finally, the limitations of this study are that due to the small sample size, lack of randomization, and absence of a control group, the results of this study will have limited generalizability. And although the SAI tasks will be individually designed for each student by an education specialist aware of their needs and present levels, all factors affecting the student's degree of successful completion cannot be determined in this study. Finally, given the evidence that continued mindfulness practice yields greater effects, the short duration of this study may diminish the extent to which the intervention's potential effect will be realized. Thank you.